Let's now bring in to discuss this further Dr. Isaac Bogoch, infectious disease specialist. Doctor, it's good to see you again.
Great to see you as well, Akshay.
So let's discuss norovirus all over again. What do we know about this and what are we looking at here in Canada?
Yeah, it looks like over the last few years where there's been fewer social activities, fewer people getting together, school closures and work closures, we clearly didn't have as many cases of norovirus. But as people are now getting back together more, there's more contact with others, we're just seeing more norovirus cases here in Canada. The same is being seen in other parts of the world, for example, the United States and the United Kingdom. And as you point out, many people watching may have had this before or have known someone who's had norovirus before, and it can be very unpleasant. It's usually manifested by severe nausea and vomiting. It lasts usually a couple of days and then tends to resolve.
And we were seeing that it mostly affects children and the elderly. How is it really transmitted, doctor?
Yeah, this is usually transmitted through direct contact. We call this the typical mode of transmission is through what we call the fecal oral route. So accidental ingestion of a food, or in contact with a surface that's now in contact with a person's mouth. And usually after about 1 or 2 days of an incubation period, the symptoms start. They can be very severe. I mean, most people won't need to come to hospital or seek medical care. Most people will unfortunately be very uncomfortable in their own home. But sometimes if there are issues with dehydration or people aren't keeping up with fluids and electrolytes, typically the youngest end of the spectrum and the older end of the spectrum, then of course it's time to come in and seek medical care, and we can help with rehydration.
What about transmission through aerosols, doctor? Is that a possibility as well?
It is. It's just much less common, and
Okay.
you can see in some scientific literature plumes of aerosols emerging from. I mean, it's not nice to talk about publicly, but this is what we're talking about, from flushing toilets and whatnot.
Sure.
That's certainly a mode of transmission, but it's most commonly direct contact fecal oral transmission.
So first, let's talk about prevention, and then we'll talk about cure. How can we prevent ourselves from getting infected?
Number one. Oh, right. So if people are sick, stay home. If people are having terrible nausea, vomiting, and occasionally diarrhea, that's not appropriate to be going out, and people should recover on their own home. The other way is, of course, good hand hygiene. Now, this one's a little bit more resistant to the alcohol hand sanitizer, so soap and water is the ideal way to wash hands. And then cleaning potentially contaminated surfaces with bleach-based products are preferable over alcohol-based products, but making sure high-contact surfaces are kept clean.
And of course, the risk is always higher when you're out in public spaces. For example, if you were to use a restroom in a mall or a movie theater, is when you should definitely make sure you're washing your hands for the 20 to 30 seconds. Lastly, doctor, let's talk about the cure.
No real cure. I mean, it usually takes a little bit of time, and it's important that people keep up with their fluids and electrolytes. So pure water is not the solution. It's helpful, but you need some salts in there as well. Sometimes broths, soups, sometimes sports drinks, anything that has electrolytes in it in addition to fluids is the right path. And most people will recover in a day or so. Some people might need a little bit of help with the fluids and electrolytes. So parents should watch out for fewer wet diapers, for example. And of course, watching older individuals who might not be able to maintain their fluid and electrolyte balance. And again, your healthcare team is always here to help if people need support, but most will be able to recover in their own home.
Dr. Bogoch, it's good to see you, and thank you once again for all those insights. Appreciate your time.
My pleasure.